Pretty simple. Healthcare, when you talk about healthcare expenditure, healthcare spending, the average healthcare spending in the United States of America, by data from the US government, is $13,000. So whether it's Medicare, Medicaid, or private health insurance, the cost of healthcare in the United States is $13,000 a year.
Per person?
Per person.
What is it here in Puerto Rico?
In Puerto Rico, that same person that moves from the mainland to the island, it's worth $4,000 per capita per year. So that's the big problem that Puerto Rico has under healthcare, because it's the same compliance rules, the same quality standards, the same cost of medication, US board certified doctors, but a third of the funding. That's unsustainable. We take pride on doing more with less, but it's gotten to a point that it's unsustainable. It's affecting the quality of care to the elder population. Medicaid in Puerto Rico, it's right now the way the matching works, Puerto Rico in December is going to fall into a Medicaid cliff. In Medicare Advantage, which is the most important program for the elder population that runs through the Medicare Advantage population, in the island, Puerto Rico is the highest penetration with the highest participation of Medicare Advantage in the United States, because it works, the economics, the socioeconomics work for the elder population. But even though we're the highest penetration jurisdiction, we're 43% below the national average, 31% below the lowest state, which is Hawaii, and 25% below the U.S. Virgin Island, which on a good day you can see from Fajardo, Puerto Rico. That's our reality, and that's why we're looking for solutions in Congress.
The U.S. Virgin Islands gets more money in Medicare and Medicaid than Puerto Rico.
In Medicare, yeah.
Okay,
in Medicaid, because of the density of the population,
yeah.
Puerto Rico obviously has to get more funding.
How many Medicare recipients are there in Puerto Rico?
Medicare, about 800,000.
How many are there?
And in Medicare Advantage, it's like 650 of those. So 80% penetration of the Medicare Advantage program. And so they get good benefits, but the providers get impacted because of the economies of scales they need to work out.
So the money you're talking about Puerto Rico needs, is that for the patient or to pay the doctor?
Well, it's for the whole system. That's the way health works. It's benefit to the patients and the payment to the providers, which is the network that the patients use.
You go to DC, you talk to these people. What do you say to them? They've heard this story time and time again. How do you get them to care? What do you say?
We say it's unsustainable. We're doing more with less. Puerto Ricans, we do pay Medicare payroll tax. We do contribute. And if you account for the Jones Act cabotage laws, Puerto Ricans contribute about $500 million every year to the U.S. economy, because every single thing that we consume in this island has to come on a U.S. flag boat. So we contribute to the U.S. economy, yet we get 43% below the national average. That's why doctors leave, because the math doesn't work.
And those doctors,
statutorily, we're excluded from certain laws, like the Medicare low-income subsidy. Under the Social Security Act, Puerto Rico is capped, so we get, we get a lump sum each year. It used to be like about $300 million a year. They've put some temporary patches here and there, but right now we need a permanent solution, because we keep going every year to Congress to see what they can do, either congressionally or administratively to fix the issues.
What gets you fired up the most?
Seeing my family, they're all in healthcare. I work in healthcare, and just to see that friends that have to go to the mainland to provide healthcare services there, which Puerto Ricans, we're a huge talent to the nation, because we're fully bilingual, we have U.S. training, we're educated under the U.S. system, but we can't provide healthcare services here because of the healthcare funding inequity. The healthcare inequity is what gets me fired up, because it is talked a lot about addressing inequities, but you have it right in front of you. Healthcare is one of the pillars of society, healthcare, education, and security. And in healthcare, we have inequity. We don't have equity. And that's a big problem that Puerto Rico has.